what is really important as well is that, sometimes people find like positive self-affirmations as really a great way of helping to feel better about themselves. So to go back to your example there around mirror image, someone looking in the mirror and feeling good about themselves. Sometimes what works really powerfully with that kind of tool is to be able to also say something positive about how you want to feel. And then oftentimes the more you say it, the more you start to feel it. But I think it's really important to mention to patients that this is a process, that it's unlikely that overnight that they are going to feel great about their body, great about intimacy. It may take some time before they get to a stage of feeling better about themselves.
And not to put pressure on themselves, because patients always do. They always put pressure on themselves that they think they should be getting back to kind of doing the gardening, or getting back to doing the washing up, or getting back to the normal household things that they do. But they've had big surgery and they need to remember that and not put that pressure on themselves and not allow other people to put that expectation on them too.
And I think that's where you as nurses come in terms of sharing your experiences of working with many patients over the years and what you have found has worked really well for them, and to remind them to be gentle with themselves and be kind to themselves. I suppose what can happen is that you have physical surgery and then overnight your body has changed, and we can't expect our brain just to overnight be okay with that and to accept that. It can take some time for the brain to catch up and to feel at peace with your body, and that's okay. But I think what's really important, just in terms of like how you as nurses close your sessions, is that it's okay to feel like there are more conversations that need to be had. It doesn't all need to take place within that one session, but the key is to be able to share as much as you can to help that patient in that session, to give them the visual tool of the connections booklet, and then give them the ownership to then go on and make better decisions for themselves to feel better about themselves.